is the city of Seattle ready to have everyone 16 plus eligible for vaccine?
We are ready structurally. We don't have enough vaccine yet. And I just have to take a little bit of a pause, Brandi, because I was thinking about where we were a year ago. And we had not even done 10,000 tests in the city. We were in the height of the crisis. We're trying to figure out how did we deliver hot meals and grocery vouchers, help small businesses. And here we are a year later, and we've got vaccines on the horizon. So we are in a better place. We're not out of the woods, but we are in a better place.
Yeah, the city of Seattle hit like a little bit of a milestone, 100,000 doses administered through the city. Is that right?
You know, it is a milestone, and we've talked about it before. We want more doses. You know, we have the ability to do almost 20,000 a day at Lumen alone. And we stress tested it last week. We did almost 8,000 on one day. And so I'm still working as hard as I can, talking to the administration. I've got the governor advocating, Patty Murray and our senators and Pramila Jayapal, trying to get us more vaccines so that we can get more people vaccinated.
Yeah, a couple of things there. And 100,000, that's just administered through city sites. That's not everyone, total in the city who's been vaccinated. I imagine that number is much higher.
I don't have that exact number, but obviously people are getting vaccinated in a range of places, through their hospitals, through their providers, through their pharmacies.
So on the subject of not having enough or being able to handle more, I think there's been this feeling that, let's make sure we get every place is like fair allotments. But I was reading about some places where they've got a lot of extra vaccines, and I don't know if that's just because of hesitancy. So when you have those conversations with the governor or the Biden administration, how do you talk to them about giving us more, and how do you make that pitch to them?
So I think the first thing that the governor, and not just Governor Inslee, but other governors have advocated for, is a full transparency at what's the total doses coming into the state and where is it going. For example, the pharmacies get their allocation, but it doesn't go through the state. So the state doesn't learn until after the fact what's coming. So the first would be full transparency on what's coming into each of the states. And then I've been advocating for and believe that we should have a system that if people aren't drawing down or using their full rates, that there would be some ability to allocate those to those of us who have waiting lists of 150,000 people who want to be vaccinated. It's difficult. Obviously, if you're at the federal level, you're balancing 50 states, and each of those states is very different. If you're a governor, you're doing all 39 counties. I'm just advocating for the city of Seattle the most.
You mentioned 150,000 people on the wait list, and that's just the wait list for city-operated vaccine sites. Is that correct?
That's correct. Now, some people will get vaccinated even if they're on the list. They find somewhere to get it, but our waiting list is about 150,000 right now.
So I guess that's that. And having gone through it today, the first thing I did, I woke up, did the morning news, and then as soon as that, I was busy trying to, and I did. I signed up.
Did you find one?
I did find one. So I am tomorrow getting my first dose. It's going to be Moderna, and I got to drive to Arlington, but I thought they had a bunch of open vaccines up there. A bunch of open slots. But for folks who maybe can't be mobile and they do need to get it in the city of Seattle, what is that experience going to be like for them, do you think, here in the coming days? How long might they have to wait?
People may have to wait a period of time. But I will say that your experience, Brandi, is exactly why we will continue to have our focus on equity, because there's a number of people who don't have access to the internet or aren't able to find that Arlington slot. And even if they could, they wouldn't have a way to get there. And so we know from the data that we have that there's certain zip codes, for example, in Seattle, where our vaccinations are still lagging behind. The Central District, South Seattle, Delridge neighborhood, a little bit of part of Lake City. If you take the rate of vaccinations, they're falling behind. So we really want to make sure that we continue to emphasize and get to those people who are most vulnerable to the disease, but have less access to other things.
Moving forward from here, I think there are people, one of the frustrations, and I'm talking on my show Sunday about vaccine hesitancy, because I continue to hear a lot of my viewers who say they aren't going to get a vaccine. And I'm not going to tell them what to do. That's not my place. But one of the primary reasons I hear two. One of them is they're concerned about they're not having enough time to really understand the possible side effects. So on that side, we saw what happened with J&J this past week. You're talking about 6 cases out of millions, and they decide to pause the vaccine. Does that just further, I guess, alienate people who were on the fence about getting a vaccine in the first place?
I think it should tell people we're being more careful. Because if you are willing to pause with such a small number of cases over millions, it shows that we're really being careful. And I will tell you, Brandi, I think the absolute best messengers to people who are hesitant are people who they trust. And so you getting vaccinated is going to make a difference for people. The other thing that makes a difference is I was just talking to a friend of mine who was able to see his mother for the first time in a very long time because she was fully vaccinated and he'd gotten his vaccinations. And that picture of them together, more people see that and realize what parts of their lives they've been missing. And, even in today, the Seattle Times had some photos of, family groups getting vaccinated together. I think that's going to really be the thing that breaks down the hesitancy of people when they realize they see people and know people, they got it, they're safe, and they're actually able to be less fearful about their health.
The other big thing that I hear from folks is they're frustrated because they feel like if they're vaccinated, they should be able to get back to life as normal. We have these big signs above the interstates. I know I pass one every day on my way to work that says, vaccinated or not, please mask up. And you've got the CDC telling people if they're vaccinated, they can travel anywhere, domestically, not a problem. And some people say, well, if I'm going to get vaccinated, I want, kind of a guarantee that I can start living life normally, and they don't see that on the horizon. So what do you say to those people?
So first, you will be able to do more when you're vaccinated. If nothing else, you will have less of a chance of getting seriously sick and even a very infinitesimal chance of dying. And that's a huge difference with this disease. Second, you will be able to see people that have been fully vaccinated, but we're going to be in a period of time that our new normal is just going to require all of us to mask up for when we're out in public. Because there's still going to be, even with as many people as we're getting vaccinated, we haven't reached that critical threshold where the disease can be controlled because there isn't enough people to transmit it to. And we still need to take those precautions. We also know that there are some people who can get the disease twice. It's very rare. There's also some people that if they get vaccinated, they may get sick. That's also very rare. But the odds are if you get vaccinated, you are on the path to not just being healthier and safer, you're on the path to the new normal, and that's a good thing.
Yeah, and we talked about that 70% threshold that we're hoping to get to for vaccinations. I know you really want to be the first city in the country to get there, but you're also talking about being concerned that we're not being given enough doses to really live up to what we're able to administer. So where are you feeling in terms of that goal?
We are still pushing as hard as we can, and I'm so thankful to all the volunteers at Lumen and West Seattle and Rainier Beach and our pop-up clinics. Most weeks I go to one of the places just to check in, talk to the firefighters, thank them, thanks the volunteers. And it really is something that is very uplifting because it's people coming together for a good purpose. And it's been so hard through this pandemic because we haven't been able to come together. There's been so little to look forward to, and there's so little we control. It's been in control. By taking these steps that we do, by getting the vaccination, by wearing a mask, by keeping our distance, we're exercising some control. And I think that should be a positive thing for people, and know that if we do that long enough, we're going to get there.